Thank you so much for organizing this, Ib. It's great to be here. I'll tell you a little bit about the geospatial problem that affects all of us, which is how do we take care of our health and how do we pay for that and how do we pay less for it. And we all need healthcare at some point in our lives. And part of my goal in building this nonprofit, we're a 501c3, is to reduce the price of healthcare by building public tools and open source ways that we can figure out where we can afford to get the care that we need. And I'm from Canada, so I did my grad school here in the US. And I know many people here are from also outside of the US. And the US healthcare system is weird because it's not public. So your employment actually determines your health insurance a lot of the time. So depending on the job you have, your hospital bill will be a different amount at the same hospital for the same procedure, for the same medication. And so why this relates to DECGL is that there's many hospitals, thousands of hospitals in the US. You could go to any of them and get usually the same things like a saline solution or medication for Crohn's or insulin for diabetes. And if you have, say, your insurance company or your job might say, like, for in vitro fertilization, so you're trying to have a baby. One of my friends, their coverage is $30,000, and then another friend at another tech company has $250,000 to spend on IVF. And so my friend with $30,000 to spend on IVF from their insurance, they're calling hospitals around the country and they're trying to solve this geospatial problem because they're incentivized to. But the friend with $250,000, they go to NYU Langone and it's fine. And so the scale of the problem is massive in the US. And that's why I reached out to the DECGL community, because there's few tools that can work with this scale of data. And I'll give you a sense of like some of the spatial problem, which is here in the US, if you go to the Bronx, which is I think that way north of Manhattan, then a C-section to deliver a baby will be $91,000. But here in Manhattan, about 3 blocks that way, 2 avenues is Bellevue, a public hospital, and the same procedure will be $40,000. And Bellevue is a very good hospital, one of the best in the world, and people fly to Bellevue to have kids. And so that price variation is crazy, that for the same procedure in the same city at like a better hospital, your hospital bill might be half. But this is very hard data to visualize spatially. So that's the challenge. So I'm open to any of your ideas about how to make sense of this, because this is text. This is an ad that we ran nearby here about 10 blocks up over the summer. And like, how do you visualize C-section? How do you visualize this $40,000 in price differences? How do you visualize thousands of hospitals and hundreds of thousands of different billing codes, procedures, medications that are in the data that we have? I can show you a little bit about how I've been trying to do this more interactively. So what's loading here is a Parquet file. I hope it's loading. This is a client-side demo. I might have to tether. Let's see. Example failed to load. Let's try another one. Yeah, I might need some internet here for the demos, unfortunately, because let's see. Okay, there we go. So what's going on here and why I need to connect to the internet is that this is loading all of the prices at one hospital in New York called Mount Sinai, and it is loaded client side. So there's about 100,000 different things and this is rendered interactively with a table that you can scroll through. And the way I visualized everything you could do at this one hospital called Mount Sinai on the Upper East Side is according to the listed minimum price in dollars, so like $0 to $500,000, and then the y-axis is the maximum price for the same procedure. So if I walk in and say I'm on Medicaid right now, then I might get charged like a lower amount, but then somebody else for the same procedure might get charged a higher amount. And this is a library called Mosaic that I'm using to render this, and it's actually running these SQL queries interactively as I filter. And it's running this regression in real time. Hopefully I can get it to work. Yeah. So every time I select something, then it's executing a SQL query in WebAssembly against a client-side Parquet file. That's a SQL table. And so here I've selected things that are, say, on the lower end, they cost $50,000, and on the upper end, they cost $350,000. So a liver transplant, if you have health first insurance, it will cost $44,000, and if you have another health insurance plan, health first something else, it'll cost $200,000. And so I'm just giving you a sense of why this data is hard to navigate for a regular person who, like, you might not know you need a liver transplant, you might be passed out, and you just have to get it. So a lot of the difficulty here is in figuring out who is actually incentivized to put in the time to care about this. And what we've found is that we need to work with employers, because again, in the US, employment determines your health insurance. And the biggest line item for a company is usually salary, and then it's benefits or health insurance. And by working with employers, we can build these open source tools and analytics and help them analyze where they're overpaying for their healthcare, where they're paying that differential of, say, $200,000 for a liver transplant or $40,000. And so this Cardo demo that I put out, this is visualizing the hospitals in the New York City area, and the height of the columns is the median time it takes to go from an emergency room admission to exit the hospital. And say over here, it might be 145 minutes of median time from admission to leaving the hospital, and then over here, it might be 300 minutes, so over double the amount of time. So this is an example of trying to relate the price of healthcare to something else about it, like the quality of it. Because if you just go to the lowest price one, it might not be the best. And so we can't send people to just the cheapest cost option. You have to give people more context around the quality of a hospital, their context around what they might need, like whether they need a C-section or whether they can plan to get an elective surgery, or they might just be going to an emergency department and they're not sure where they can afford to get care. And then Alberto helped me use the Cardo builder and then try representing the same data, and it was so much easier to get this to work than the DeckGL version. So thank you, Alberto. This is the same data for the New York City hospitals. And we are trying to scale now, and we collected 4,000 hospitals' prices. Each hospital has millions of things you could do there, but there's thousands of insurances and between 10,000 and 100,000 different prices of medications, procedures, and treatments, and the price might be different by insurance. So we are looking at petabytes of data across these 4,000 hospitals that we have data on, and some of the plain text fields might relate to like a newborn, maternal care, or insulin, or Blue Cross. And a lot of the machine learning work I'm doing is to clean up the data, do ETL, and that's all preceding the need for scalable geospatial visualization. to categorize these things appropriately and make them comparable across hospitals across the country. And there's a few different options now, and it was awesome to hear about Kyle's work on GRO and GeoParquet yesterday. We'll keep trying to use DeckGL and Carto for filtering. I wanted to mention Honeycomb. If people haven't seen that, I'll show a quick demo of this. It's a in-browser client-side rendering of the same data, and this should render a national data set of all hospitals in the US. And it's nice that it's doing this client-side with H3, and you can select different views of the data, like say mortality measures or safety measures at the hospitals, and then see aggregate statistics about all hospitals in the US rendered client-side. So that's one way we're thinking about scaling to petabytes and having smaller subsets of the data rendered client-side to avoid paying for BigQuery or to avoid paying for AWS Lambda costs. Protomaps is another option that's great because it lets you generate custom tiles and then serve them through a content delivery network. So again, you're avoiding paying for server costs. And the way we've been able to do this as a very small nonprofit on a small budget is mainly Colab notebooks with large language model queries and Parquet, because Colab notebooks let you load, say, all zip codes in the US with one line. They're easy for undergraduate or graduate students to parse, and you can have GPT generate these SQL queries like Alberto was showing us to, say, map the hospital zip codes to latitude and longitude coordinates, and then get to something like the DeckGL visualization with the fewest number of lines of code in a somewhat reliable workflow for volunteers and people that we work with. So the plan for scaling is doing more machine learning to filter what you can do at a hospital with vector search, because it's one of the few ways to search through a large amount of plain text in a scalable way. But I'm not sure yet how to get DeckGL to work nicely with vector search. So if you have any ideas, I'd love to chat. Incremental static regeneration is a cool Next.js feature we've been using, and that lets us render pages statically on the edge and then render these dashboards on the edge without needing to do things on the server. And thank you very much, Carto, for a grant that lets us test BigQuery and see how much we can scale. And feel free to reach out if you're interested in figuring out the price of healthcare and how to reduce it with open source public tools. And thank you so much. I'm excited for lunch.